we have our original thought process of our price method, right? We know we talk about protection, protection, rest, ice, compression, elevation, or just basic RICE, rest, ice, compression, elevation. But I think as we're starting to rehab these patients, we're starting to know that maybe ice isn't really the best thing for these patients. I mean, just in my opinion, I think for an acute injury, ice is certainly mandatory and something very, very acceptable and appropriate. But we know that ice can kind of slow down some of the healing times as it starts to kind of disrupt our normal inflammation and our revascularization of that tissue. Although following an acute injury, rest and protection of the limb is still recommended, right? We know that, but long periods of rest and protection can be potentially detrimental to recovery, leading to like muscle wastage and altered biomechanics of the limb. So the clinical bottom line here is that peace and love is a really good alternative and solution to this. We talk about protection, elevation, and really avoiding, especially early on, ice and anti-inflammatories or non-steroidal anti-inflammatory drugs or NSAIDs. Education is always important, and really trying to promote our loading, our optimism with our patients, vascularization exercise, whether it's active range, active assist, PREs, isotonics, isometrics, trying to promote that as early as we can to aid in a quicker and faster healing time.